Hello, everyone, and welcome to the Down Syndrome Center podcast. I'm your host, Dr. Kishore Velodi, and we are really excited today. We're going to have a topic that we haven't yet addressed on this podcast that is so important and one that we get lots of questions on, particularly around this time, August, September, as schools are opening. And that is based on like school behaviors and IEPs and where do we start with all those things. And we at our center, for those of you who don't know, have a behavioral center. And Dr. Tarin Santamaria is joining us today. Tarin, why don't you do this? Why don't you tell us who you are, what you do, and why you love working with our population? Thanks for joining us.
Sure. Thank you for having me. Yeah. Hi, I'm Dr. Tarin Santamaria. I'm a psychologist in the Down Syndrome Center. I'm a licensed psychologist and also a state and nationally certified school psychologist. In our center, I see individuals birth to 26 years of age. Most of the time, I'm seeing kiddos for a psychological evaluation. That's the first appointment. And then I offer outpatient therapy. A lot of the referral concerns tend to be behavioral in nature and sometimes emotional concerns like anxiety or mood related. And a lot of the time I'm helping parents by giving behavior management consultation and some supports around skill acquisition.
You know, what's been so great is having you as part of the team is, before you were here, a lot of these issues we really had to try to refer out. And there aren't a lot of places that have child psychologists ready and waiting and understanding of the issues that our population deals with. So that's been really great. One of the things that we did many years ago, we did some podcasts with David Stein. Our listeners, I would direct you back to those to really look at some of the behavioral issues that you can see in older kids, but really in younger kids as well, that we kind of focused on. But today I was really hoping we could focus on more the school age and older child and some of the behavioral issues that you hear about, Dr. Santamaria, and things that we can talk about today. So what are some of the more common school age children type behaviors that you see in the kids in our clinic?
Sure. A lot of the concerns that I hear of are refusals, non-compliance. So an adult, like the teacher, gives the kiddo a direction, like, please take out your paper. We're going to start doing reading. And the kiddo says no, or somehow refuses, maybe swipes item off their desk. Some other ones are difficulties with transition. So this could be transitioning between activities or even transitions from point A to point B. So going from the recess outside back to the classroom. Some other concerns are elopement. So leaving the classroom or leaving the assigned area, running away. Tantrums are pretty big. So anything like yelling, aggression, swiping, throwing items. The stop and flop is another one. So falling to the ground, refusing to move. Sometimes more escalated behaviors become part of that. Yeah. And then limit testing. So kind of like towing the line, trying to see how much the child can get away with, trying to see like what the people's boundaries are. And then another big one is power struggle. So attempting to control their environment, only doing things when it's on their terms and in their time.
And I mean, these are, as you say them, each one of them, I'm just nodding my head because this is something that we hear, if not August, September, as the year progresses, some of these behaviors will start to put themselves on display. And then, of course, you put pandemic on top of it. And so many of the kids were at home and mom and dad were a teacher. And of course, a lot of behaviors came to the surface that maybe weren't there so obviously before. So there's no way for us to kind of go through each and every one of these individual issues and talk about your approach to each one of them. But is there like a general basic, like when we send a family or if a family calls to make an appointment with you, what can they expect in an appointment as you address these types of issues? What do you do?
Sure. Well, so I try to figure out, okay, what's the behavior? When's it occurring? Are there certain things that are happening right before it? And then what happens after the behavior occurs? That helps give me information about the whys, which is like the function of the behavior. Is it to get attention? Is it to escape directive? Is it to avoid something non-preferred? Is it to get something that I really want? And when I can figure out those things, then I can determine, okay, this is the intervention that we should try based on the function. And then I also try to tease apart, is there a skill deficit that's present? So for example, for a kiddo who is maybe doing something attention seeking, like being silly and goofy in class, kind of being the class clown, they're seeking attention from peers. That's the function. So then I know, okay, maybe planned ignoring is the best approach, but what's the skill deficit? That's probably how to interact with peers, how to initiate a conversation or play interaction, like how to gain attention in an appropriate way. So it's kind of two-pronged. What's the function? How do we address it? And where's the skill deficit?
It's almost like I've heard someone say before that all behavior is communication. And I
Mm-hmm.
think that for so many of our kids, the communication may be an area that they may have some struggle communicating their exact needs or concerns. And so they'll communicate essentially through their behavior. Is that something you would agree with too, something you've
Yeah,
seen? Yeah.
exactly. Mm-hmm.
And so your approach then is like, I've heard people say this, and if I'm wrong, tell me. But I've heard people talk about the ABCs of behavior. The A
Yeah.
comes before the B. So what comes before the behavior? The C is the consequence. One comes after the behavior. So you're
Yes.
trying to see what is it around the behavior that
Sure.
might be triggering these things. Is that kind of what you're telling
Yeah, that's
us?
exactly right.
Yeah.
So A stands for antecedent. And
Yeah.
so in a situation, maybe it is, I'm thinking for like the attention seeking kiddo. So antecedent might be that the peers are talking amongst themselves. The behavior is the kiddos started to act silly or goofy or maybe say potty talk. C is consequence, but it's not consequence in terms of like, oh, we're going to give this kid a consequence. It's what happens as a result of the behavior. So in that instance, probably the other kids are laughing and thinking it's funny. So then the kid's getting attention for doing the potty talk or acting silly and goofy. And when the kids give attention, it maintains the behavior and makes it more likely that that behavior is going to occur again. So then we know, okay, this is attention seeking. We should use planned ignoring. Maybe we should direct the other kids, if something like that happens, that we should not give attention to it and
Yeah.
redirect the rest of the class as well.
And I'm sure in your clinic, similar to when they come to see me for a medical visit, many times the families and even the teachers might have been focusing on the behavior only. How do we reprimand or fix the behavior? And they're missing the A and the C
Mm-hmm.
of the ABC. And that's hard to do, right? When you're a parent, it's really hard to figure that out because you're not in the school. So what is it
Yeah.
that the school system should be doing to help to figure out these behaviors?
Sure. When behaviors become problematic, a lot of times what schools will do is they'll look at what's an FBA, like looking into how do we go and observe the behavior and figure out why the behavior is happening. And then they create a lot of behavior plans. And then the next steps might be, okay, how do we implement interventions with just the general ed teacher? Do we need to put more adults to be supportive people like paras and aides? So that's kind of how they start thinking about it.
And it becomes an alphabet soup. I know personally myself with these IEP and FBA and all these things. So maybe you could just really quickly tell us like what are these things? What is IEP? What is FBA? What are these things?
So an IEP is an individual education plan. And what it is when there's an individual who has a specialized need, then they go through, it can be identified by the school or by the parents. They go through what's called an educational evaluation. Sometimes people call it an ER. And they try to figure out, does this individual have a disability and is it impacting education? And when it meets those two criteria, then they try to think of, okay, we need to put a plan in place to help the kid be successful at school. So through the evaluation process, they determine what category the child may qualify for special education under. Sometimes it's speech and language impairment. It can be other health impairment, specific learning disability. There's 13 criteria. And then based on the child's individual needs, they might say, oh, okay, this kid needs speech therapy. This kid needs occupational therapy. This kiddo might need some push in or pull out academic supports. When there are behavioral needs, this is kind of like a second step to the educational evaluation in the IEP process. They look at the FBA, which is the functional behavioral assessment. And that's when we are going in trying to figure out, why is the behavior happening? What can we do to improve it? What interventions? How do we design this plan? And the plan is called a positive behavior support plan, and it's tacked on to the IEP. So everybody who sees the IEP sees the positive behavior support plan, and then they know how to respond to this child when those target behaviors happen. So everybody's on the same page and super consistent with their approach.
And I think that's so helpful for us to understand is that this helps the first period teacher and the fifth period teacher address this behavior in the same way so that the child isn't learning in different locations. The behavior will have a different impact. Is that kind of the goal
Right.
of it?
Yeah. So everybody knows why the behavior is happening. and what to do in response to it, or even some preventative and proactive strategies, which is what I always try to focus on. How do we prevent the behavior from occurring to begin with? I think that's
Yeah.
really important.
And are these things that the school system, all school systems have to provide, or is it that only school systems in neighborhoods where they have high taxes and they can bring in the money to do it? Like what school system should be able to provide these services?
Sure. Every school district has the ability to do this. The FBAs are typically done by the school psychologist. So that would be a good person to reach out to. Some districts have a behaviorist or something with a similar title. Not every school district has that individual, but every school district has a school psychologist. And that tends to be the person that does it. The school psychologist is also the one that does the educational evaluation. So I think they're a really good point person for our families to contact if there are concerns on needing an IEP or needing a positive behavior support plan.
So you're saying if you're a parent and your child is demonstrating behaviors and you're getting the sense that the teachers are having a hard time educating your child because of these behaviors, then the parent can just reach out to the school psychologist directly, or do they need to reach out in any other places or right to the psychologist?
So a lot of our kiddos already have IEPs in place. So there's probably an IEP lead. So that would probably be your first point of contact. That tends to be a special education teacher. Sometimes it's like a guidance counselor. That would be the first person that I would try. And then, then go to the school psychologist after that if that doesn't work out.
Wonderful. And something that we've unfortunately heard from a lot of families, one is a lot of families don't even realize that they can do a functional behavioral assessment, that even exists. And I think to me, that's the first step, is letting families know that exists. And then the second thing that we hear, unfortunately, is that if the child is having significant behaviors, then this would mean that they have to leave the inclusive education environment that perhaps they were in. What are your thoughts on that?
So there's a rule that's called least restrictive environment, or LRE for short. And that means that our kiddos have to be educated in the general education setting. And so when we think about the very least restrictive environment, that's general education without any supports in place. And then based on the individual's unique needs, we add support so that the child can be maintained in the general education classroom, which is the least restrictive, with their same age peers or same grade peers. So that might look like, okay, if this child is having academic or behavioral needs, maybe let's try these interventions. Let's do this positive behavior support plan. Then it might be, okay, let's add an aide or a para or involve the kiddo in some skill development groups. And then it gets more restrictive as the needs become more significant. When we think about needing a more restrictive environment and taking the kid out of the general education classroom, that's when the kiddos' behaviors are so significant, they're disrupting their and others' learning. So when all of these push-in supports in the general ed aren't working, then we have to think, okay, does the kiddo need to be in the learning support room for a small portion of their day? Or do they need to be in the life skills classroom for a portion of their day? And then it gets progressively more restrictive based on the severity of behavior. So it doesn't automatically mean life skills at all.
So I just want to clarify. So in your experience, and what you would say is, if a child is having behavioral issues and they have Down syndrome, the first step would be to try everything to try to address those behaviors within the least restrictive environment of that inclusive education classroom, and not to automatically assume that they must go to a life skills or learning support type classroom.
Yep, that's correct.
Okay. Yeah, and I think that's so important for our families to hear and to know that at the center, we strongly support those thoughts, and that we would want to make sure that people are advocating for kids not to automatically assume that behavioral issues cannot be addressed in a typical classroom. And so I appreciate you sharing that and explaining that to us.
Sure.
Well, I feel like we've gone through a lot of things already today. Are there any other things or any other topics that you wanted to really touch on more deeply before I kind of give some information on how people can make an appointment to see you in our center?
So I think along the same lines about talking with LRE, I know this kind of might be a little bit of a side conversation or topic, sure, but a lot of our families might be concerned that our kiddos automatically be placed in life skills upon going to kindergarten. I think that's a really big topic of conversation among the parent groups right now. Just because our individual has Down syndrome doesn't mean they automatically need to be put in a life skills environment. We always go least restrictive environment first. and it doesn't matter if it's academic or behavioral needs that the individual has, we always want to try providing services and supports in the general ed classroom until those supports are no longer effective or not enough to meet the child's needs. And then we think about pull out or changing a classroom, but that's like last resort. So I think that's kind of a myth or maybe the old way of thinking. And hopefully our districts are also on the same page as us as being very pro inclusion.
It's so varied, right? I mean, I think there are some districts that do inclusive education very well, and then there are others that really don't. I would direct our podcast listeners to the podcast we did just about a few months ago with Ricky Sabia from the NDSC, talking about the benefits of an inclusive education, not only for the child with Down syndrome, but for the other children in the classroom, that they also benefit from having kids with Down syndrome in the classroom with them. And so I think this is something that is so important. And I've heard families say that the school district has promised that we would just do life skills for kindergarten and see how it goes. My experience has been once they start you there, it's almost next to impossible to get out. Has that been your experience too?
Yeah, sometimes I've had families tell me that we're going to put them in life skills until we're done testing. That's not how it's supposed to work. It's the child is in general education and adds supports and services until the child can be successful and their needs are met. It's not supposed to be the other way around. The child's not supposed to have to work their way out of life skills.
Yeah, that's so important to hear. Thank you for sharing that.
Sure.
Well, for our families who are local, here within our region, I wanted to make sure you're aware that Dr. Santamaria is a part of our center and has been for many years now. She does all of our behavioral evaluations, from to her probably simple issues that she can deal with, that she can address, like things along the lines of simple behavioral changes that can be made for a toddler and things of that nature. And then to things like this, where more complicated, looking at school age behavioral issues and trying to coordinate multiple different angles of that. So for families that are interested in seeing Dr. Santamaria, we always recommend that you start with a medical evaluation. If we haven't seen you in the center for a medical evaluation within the last year, please do call and make that appointment. And then if we need to, we can certainly refer very easily to Dr. Santamaria. You just call the same number, 412-692-7963, to make that appointment. And we can gladly get you connected as needed with Dr. Santamaria. Anything else from a contact perspective? I think I got the right numbers, right, Tarin?
You got the option one. That's the only thing I was going to, option one is scheduling. I think families sometimes don't know like the amount of different referral concerns that I can help with. So anytime there's concerns about development, any areas of skill deficit, behaviors, anxiety, depression, concerns with emotions. And I do a lot of educational advocacy. Like I said at the beginning, I'm a school psychologist by training. So I like to help, provide education to parents and support them through their educational careers. And then I do a lot of consultation too with teachers, school districts, and even if a family already had in place some in-home or maybe the wraparound services, I consult with those teams as well. So there's a lot that I could, and I'm very willing to help with.
Wonderful. And for our local families, just so you're aware, this center has been in existence for over 30 years, and it's been in existence mainly, in fact, almost all by philanthropy, by people who have given to our center. And so what we're able to do, the uniqueness of being able to have a psychologist on our team who focuses and specializes in Down syndrome, and then all the other things that our center does, it all comes through giving. And so if you're interested in being a part of what we're doing, please do check out www.give2children, all one word, give2children.org/Down syndrome. And if you go there, you can make a donation if you can. As you know, with COVID and everything that's been going on, it's been a lot harder to bring in the donation. So we would love to be able to include our podcast listeners if you would like to participate in what we're doing, being able to keep this podcast going as well. All of those things, we would love to have you partner along with us. But in the meantime, if you have any questions, anything you want us to address, send us an email. We would love to know what you would like us to talk about on the podcast. I am glad to look for speakers that can help to address any questions that you may have. But until next time, bye-bye.